I am honored to introduce our next speaker, Elliot Fieldhouse-Allen, who will speak to us on the topic AI meets bloodless medicine.
Hi there.
Hi. Elliot Fieldhouse-Allen is a dynamic leader and innovator in AI-driven solutions across healthcare, education, and drone surveying industries. With a background in computer science and AI, he founded DataWyse AI Limited, an AI consultancy specializing in accessible machine learning tools for SMEs. Under his leadership, DataWyse has partnered with Columbia Healthcare Analytics to develop groundbreaking applications of AI in medical diagnostics, focusing on enhancing clinical data processing and predictive analytics. Elliot also serves as the technology director at Eyes in the Sky Limited, where he leads the development of AI drone imagery analysis and environmental monitoring solutions. A key player in applying AI for heritage conservation, environmental health, and infrastructure assessment. He is at the forefront of combining AI and real-time data collection for impactful results. His current research includes projects in vegetation health and invasive species detection using drone-based multispectral imagery, conducting in collaboration with the Swedish partners. In addition to his professional pursuits, Elliot holds a bachelor's with honor in audio engineering from Middlesex University, completed in 2014, with a dissertation focused on cochlear implants. His research explored the limitations of cochlear technology at the time, including the challenges in enjoying music due to restricted frequency bands and the quantization of all sound to approximately 8 to 10 points on the sound spectrum. Elliot, I look forward to hearing your talk today. Thank you for joining us.
Thank you very much. Yes, let me just share my screen. Okay, here we go. Hey, so good morning, afternoon, evening, and night, depending on where you're listening to this lecture from. It's a privilege to address you at the Bloodless Medicine and Surgery Society's annual scientific conference 2024. Today, I will share insights on how artificial intelligence is impacting medical diagnostics in ways that are relevant and practical for bloodless medicine, highlighting both opportunities and challenges. I have no financial disclosures for this presentation, so let's get started. I'm an AI specialist with a background in engineering and have been working in the AI sector for the last 3 years, and I am currently wrapping up a Master of Science in Computer Science with Artificial Intelligence alongside my work as Managing Director of DataWyse AI Limited. We are an AI consultancy specializing in helping small to medium enterprises access AI technologies across various sectors. Our partnership with Columbia Healthcare Analytics is founded on a shared vision to leverage AI and machine learning for improving diagnostic and review processes. Together, we've been working on streamlining clinical data processing to reduce administrative burdens and enhance efficiency, most prominently using statistics, machine learning, and artificial intelligence to demonstrate unnecessary blood transfusions in hospitals, allowing them to reduce the amount of blood used on patients unnecessarily, saving the hospitals money and improving the quality of care in patients, moving hospitals towards the goal of bloodless medicine. The learning objectives for today's presentation are: I'm going to demonstrate how AI-powered diagnostic tools can enhance patient outcomes in bloodless medicine by supporting more precise and timely clinical decisions. We're going to explore the application of multilingual large language models in overcoming language barriers for global diagnostic consistency and infection surveillance. And we're going to briefly investigate the ethical and regulatory implications of implementing artificial intelligence in healthcare, with an emphasis on maintaining data security, patient privacy, and transparency in AI-generated insights. The amount of patient data we handle has grown exponentially, making it increasingly challenging to extract actionable insights efficiently. In bloodless medicine, where minimizing blood loss and avoiding unnecessary transfusions are critical, diagnostic precision is paramount. Artificial intelligence offers tools that can assist us in interpreting complex data more effectively, supporting clinical decisions without replacing the essential human element. AI algorithms can aid in interpreting imaging studies to detect signs of internal bleeding, vascular anomalies, or melanomas. AI models can analyze patient data to predict anemia or bleeding risk, allowing for proactive management. And AI can assist in interpreting lab results like coagulation profiles, enhancing diagnostic accuracy and patient monitoring. Here's some examples of imaging segmentation using AI. What imaging segmentation means is that AI can highlight unexpected features of imaging results, as you can see by these 4 examples here. Now we're going to move on to medical large language models, or medical LLMs as they're known. A simple way to understand how large language models, or LLMs, work is they're trained on massive amounts of text, learning patterns in language over time. You can think of it like how we learn a language, by seeing examples and understanding how words and sentences fit together. The model doesn't know things the way a person does, but it's learned to recognize patterns and relationships between words. So when it reads or generates text, it predicts the next words based on these patterns, aiming to make its response logical and relevant. In medicine, this means an LLM can take complex language like patient notes or research papers and interpret it accurately, making it helpful for summarizing, translating, or even generating suggestions based on input from a healthcare professional. Today, we're witnessing a pivotal shift in medical diagnostics, driven by advancements in large language models. These models, initially developed to understand and generate natural language, have evolved into powerful tools capable of processing vast amounts of medical information with remarkable accuracy and sensitivity to context. The LLM I have used, and will be showing examples of operations with, has been fine-tuned with a dataset of 46,000 internationally recognized clinical practice guidelines from various healthcare-related sources, including hospitals and international organizations, 16.1 million abstracts extracted from closed access PubMed and PubMed Central papers, and full text articles extracted from 5 million publicly available PubMed and PubMed Central papers. In this example, I used an example of a patient exhibiting thyroid dysfunction symptoms, which is a pretty standard, diagnostic situation. And as you can see, here are its outputs. This medical LLM has been instructed to provide a couple of options for diagnosis in order to prevent getting stuck down one specific diagnostic pathway. But as you can see, it has identified two potential options, one of which being thyroid dysfunction, and it has suggested various tests that can be used to sort of assess whether or not it is a thyroid issue or is Addison's in this suggestion here. LLMs can facilitate telehealth by breaking down language barriers, enabling doctors and patients who speak different languages to communicate effectively. This capability also allows doctors worldwide to collaborate on cases in real time, providing remote areas with access to global expertise regardless of the language that they are practicing in. So I put the same input as before, a thyroid dysfunction, but I used Pidgin English as the input language, asking it to output in British English to demonstrate an understanding of both languages. Now, it's unlikely that doctors in Nigeria would write patient notes in Pidgin English. However, using AI transcription and diarization, practitioners can communicate with patients in accessible languages, record the discussion, and have patient notes automatically composed in standardized clinical English. I then did the exact same thing in French, and as you can see, it can understand the French and output English. And I also did the same with Arabic. One thing to note is that in all of these examples, I've input one language and got it to output in English, but you can actually put English in and get Arabic out. You could put English in and get French out. You could put French in and get French out. So it's really, really, it's multimodal in language terms, essentially. Multilingual LLMs support real-time infection surveillance by tracking data from various regions, providing consistency in infection trend analysis. LLMs are able to offer treatment recommendations aligned with local guidelines, helping drive global treatment standardization and improve patient outcomes. But also, what this means is if a practitioner is practicing medicine in another language, they don't need to translate what they're doing into a reportable language. This can automatically happen. And not only that, automation can automatically report the statistics as they come in. By standardizing medical diagnostics, multilingual LLMs can significantly improve access to and healthcare equity, particularly in underserved regions. DataWyse and Columbia Healthcare are positioning themselves as leaders in this field, enabling equitable, standardized, and real-time medical diagnostics worldwide. While artificial intelligence holds significant promise, it's important to recognize its limitations. AI systems may generate false positives or false negatives, leading to unnecessary tests. AI depends on data accuracy, and poor data can mislead the outputs. And compatibility issues can challenge artificial intelligence integration into existing clinical workflows. And of course, it's important to ensure data privacy and obtaining consent when implementing artificial intelligence solutions. Several studies indicate that artificial intelligence improves diagnostic accuracy in imaging and predictive analytics. AI-assisted imaging helps early detection of many different conditions, and the sooner a problem is identified, the more carefully that patient can be managed, resulting in a lower likelihood of blood transfusions. However, it's important to approach these findings with balance, understanding AI as a tool to assist, not replace clinical judgment. At DataWyse AI, we have a creed which we live by, which is AI generated, human verified. As we, both the industry as well as the partnership of Columbia Healthcare and DataWyse, continue to develop our AI capabilities, reducing false positives is a priority. By refining these models to improve accuracy and reliability, we will be increasing the utility and effectiveness of artificial intelligence in clinical settings. This directly benefits patient outcomes by ensuring clinicians receive accurate and actionable insights. Transparency is key in healthcare. Explainable AI enables clinicians to understand the rationale behind artificial intelligence-driven recommendations, fostering greater trust in these systems. This transparency not only helps in decision-making, but also supports compliance with regulatory standards and ethical practices in artificial intelligence usage. AI offers exciting possibilities for supporting tailored patient-specific strategies, moving healthcare away from a one-size-fits-all transfuse everybody approach. By leveraging patient data and predictive analytics, artificial intelligence has the potential to help clinicians design personalized care plans, ultimately improving patient engagement and outcomes. This approach showcases how AI can enhance the precision and relevance of medical interventions, leading to more effective and patient-centered care. And collaboration with medical professionals, such as the people watching the presentation today, is vital. By actively engaging with each other and, amongst all the stakeholders in the healthcare sector, we will ensure AI tools are practical, clinically relevant, and aligned with real-world needs. This partnership-driven approach will also facilitate continuous feedback, allowing us to iteratively enhance solutions to meet the evolving demands of the healthcare industry. Compliance with regulatory standards is necessary when integrating AI into medical diagnostics, requiring rigorous testing and approval processes. Respecting patient autonomy and privacy is vital. Ensuring robust data security measures are not only legal requirements, but essential for maintaining patient trust. In summary, AI has the potential to be a valuable support tool in medical diagnostics, offering benefits particularly relevant to bloodless medicine. By addressing challenges, we can integrate AI in a way that enhances practice without overburdening practitioners. Collaboration between AI specialists and medical professionals is essential to ensure effective technology development and implementation. Thank you for your attention. I'd welcome any questions you may have and would appreciate hearing your insights on how AI can be integrated into your practices in bloodless medicine. The references for my presentation can be found on the PDF version, which will be available for download.